Now we'll see some of the important points that are commonly tested for headache in PLAB. I want you to understand migraine is the most common thing and most commonly asked question. Trigeminal neuralgia, we all know that. But apart from these two, subarachnoid hemorrhage is another type of headache where you will have sudden onset headache, usually described as the worst headache. Patient usually can also describe it as thunderclap headache. This is the key point for subarachnoid hemorrhage. There is also some other types of headaches such as reversible cerebral vasoconstriction syndrome, RCVS, in PLAB examination. If a patient is female and is using cocaine presenting with sudden onset of headache, there are two most important differential diagnoses you'll have to remember. One is subarachnoid hemorrhage and another one is reversible cerebral vasoconstriction, that is also called as RCVS. You'll have to remember this. Here is a famous question mentioning that the patient has got a change in the character of headache over 6 months. You will have to think of tumor. If the patient has got neck pain, neck stiffness, fever, you will have to think of meningitis. Glaucoma, there will be red eye, there will be mid-dilated pupil in glaucoma. Usually the headache worsens after coming out of a movie theater, or the headache usually worsens when coming into the bright light. You'll have to remember this for glaucoma. And the differential diagnosis for glaucoma is again migraine and conjunctivitis and uveitis as well. All right. Next, we will talk about chronic headache or analgesic overuse headache. If the patient has got headache which is present for more than 3 weeks and is basically using analgesics for more than 3 times a day, over 3 weeks and 3 times in a day, it is usually called as analgesic overuse headache. It is also called as medication overuse headache. Medication overuse headache. Please do remember, for medication overuse headache, there must be overuse of medication, that is 3-3-3 rule. More than 3 times per day, more than 3 months, more than 3 weeks. This is what you will have to remember for medication overuse headache. Now we'll talk about some of the headaches which are basically the cluster headache and trigeminal autonomic cephalgias. Remember, cluster headache is strictly unilateral, please. There will be only unilateral headache. If it is a bilateral frontal headache, it is not a cluster headache. This is what you'll have to remember in order to answer your question for PLAB 1. There will be severe pain in the eye, that is the orbital pain, and there will be nocturnal attacks as well. Cluster headaches is usually associated with the lacrimation, rhinorrhea, ptosis as well. There will be tearing from the eye as well. This is what you'll have to remember. What is the most important question that is asked in PLAB 1 for cluster headache? The treatment, the type of the treatment that is usually asked. Acute attack, you will have to tell the patient that 100% oxygenation is first most important thing for cluster headache. Here comes the tricky question. The examiner will tell you everything, but the patient does not want to use 100% oxygen because the patient is a smoker and does not want the smoking cylinder to be present in his room. What do? You will have to make sure that sumatriptan subcutaneous can be given. All right, this is one most important thing. Okay, however, 100% oxygen is more effective in cluster headache than sumatriptan. What is the first preventative medication for cluster headache? It is the verapamil. It is a calcium channel blocker. All right. Next, if the patient is not responding to verapamil, it is the corticosteroids or topiramate. Please do remember that this is not asked for your level. All right. Next, we talk about trigeminal neuralgia. Whenever there is a sharp, sudden, stabbing pain, intense pain lasting for seconds and usually affecting the trigeminal distribution or the cheek and is exacerbated by shaving or eating or chewing or exposure to cold, that is trigeminal neuralgia until otherwise proven. I do not want to take more time from you. But please do remember, for trigeminal neuralgia, it is the carbamazepine that is first line. Most recently asked question, the patient has got carbamazepine that is started. There is a side effect. What is the side effect of carbamazepine? It is hyponatremia, because SIADH is one of the important causes of carbamazepine. What do you do if the patient has got carbamazepine? You will have to start eslicarbamazine, or if eslicarbamazepine is not available in the options, you can also use lamotrigine. Please do remember that. When the patient is young and has got intense pain, unilateral stabbing pain lasting for seconds, it is trigeminal neuralgia. But if the patient is elderly patient and is more than 60, he will need an MRI brain, just to rule out if the patient has got any multiple sclerosis or any tumor. This is one thing you will have to remember, please. Alright. And what is the mechanism for the trigeminal neuralgia? It is a vascular loop that is compressing the nerve. So, trigeminal neuralgia is usually caused by a vascular thing that is compressing or looping around, the vascular loops around the trigeminal nerve. That is one most important thing you'll have to remember. Next, we talk about migraine. When I talk about migraine, it is usually headache, unilateral, associated with aura, nausea, vomiting, photophobia, sometimes sensitive to noises. This is one thing I will have to remember. Examiner is not interested in this. Examiner wants you to understand that the acute treatment for migraine is important. So, triptans are the most important medication for migraine. It is the sumatriptan that is the most important thing. Everyone knows this, but the examiner wants you to test if you are looking for any side effects or any risk factors for triptan use. Remember, strong smoking history. You will have to be careful with the use of sumatriptan. That is one most important thing you will have to remember. Next, we talk about the preventative medications. Whenever there is preventative medications, it is usually propranolol or sodium valproate or topiramate or amitriptyline. We can use it as a preventative medication. Alright. 4 to 72 hours, it is usually migraine. The examiner can also ask you about a variant of migraine that is called as hemiplegic migraine. What is hemiplegic migraine? Whenever the patient has got migraine and is usually associated with unilateral weakness of upper limbs and lower limb, that is hemiplegic migraine. Alright. The most important differential diagnosis for stroke is hemiplegic migraine. Alright. So please do remember about hemiplegic migraine. This is very important. Propranolol can be used as a preventative medication. Topiramate can be used as a preventative medication. Amitriptyline can be used as preventative medication. Remember, of all these three medications, propranolol, topiramate and amitriptyline, which one interacts with the OCPs? It is the topiramate that interacts with the OCPs. That is why we will have to be careful when considering topiramate in females. Remember, it is contraindicated in pregnancy because of teratogenic effect. Alright. Next, we talk about blackouts and syncope. Remember, whenever there is a blackout that is happening, whenever a blackout question is asked in PLAB, it is usually the vasovagal syncope. Patient will be presenting with nausea, that's a prodrome, associated with sweating, usually have got blackout or collapse within few seconds, followed by immediate recovery, that is vasovagal syncope. What are the most important risk factors, or what are the most important provocating factors? It is patient prolonged standing, intense pain provoked by emotion. This is vasovagal syncope. There will be prodrome, pallor, sweating, loss of consciousness, and followed by immediate recovery. One blackout differential diagnosis is epilepsy, but if you are considering epilepsy, the patient must be having post-ictal confusion. This is one thing you will have to remember. There can be tongue biting as well. Urinary incontinence is also associated with epilepsy. Whenever for your level, if there is epilepsy, please do remember that post-ictal confusion is the most important thing. Or during the episode, patient will not be responding to you. There are some seizures where patient can be responding, but remember for your level it is the epilepsy with tonic-clonic contraction, not responding, tongue biting, and patient has got urinary incontinence. You will have to think of epilepsy. Next, there is another condition called Stokes-Adams syndrome. Whenever there is Stokes-Adams syndrome, it is basically because of the arrhythmia that can cause blackouts and decreased loss of consciousness or loss of consciousness. Why is this Stokes-Adams syndrome causing sudden loss or sudden collapse? It is basically because of the decreased cardiac output that is happening. So, for blackouts and syncope, you will have to do investigations such as ECG and blood pressure, tilt table test, and EEG if you are unclear and you are doing EEG because you are thinking of epilepsy. I'll tell you some of the clinical scenarios where the examiner can ask you about vasovagal syncope, epilepsy, Stokes-Adams syndrome. A 54-year-old female patient is waiting for the bus, and now the patient had a sudden episode where she lost consciousness but has regained full recovery. She is not confused after the episode, that is vasovagal syncope. Or a military guy standing in a parade and now he has got loss of consciousness, it is vasovagal syncope. Talking about epilepsy, patient has got epilepsy with contraction of upper limbs and lower limbs associated with tongue biting, urinary incontinence. He is confused for 30 minutes. That is epilepsy. Stokes-Adams syndrome is basically because of the arrhythmia that is causing loss of consciousness. Patient has got palpitations or discomfort in the chest. Patient lost consciousness and immediately regained the consciousness. It is Stokes-Adams syndrome. Some of the exams or mock exams can test you down on one of the condition called carotid sinus hypersensitivity as well. This carotid sinus hypersensitivity usually causes blackouts because of the baroreceptor hypersensitivity, which can cause bradycardia and vasodilation. That is why patients can be having blackouts as well. I also want you to understand that blackouts can happen because of hypoglycemia. So please do make sure that if the patient has got hypoglycemia, it is usually associated with sweating as well. Patient can present with the tremor as well. Alright, next we talk about the other causes of blackout such as postural drop, where there must be systolic blood pressure drop of more than 20 in order for you to call as postural hypotension. Alright, there is something called hyperventilation syndrome where patient can be hyperventilating if the patients are anxious. That can also cause blackouts. Alright. Next, we talk about transient global amnesia. Remember, transient global amnesia is basically sudden loss of memory and the inability to form new memories. This is one most important thing the examiner can ask you. Inability to form new memories. That is transient global amnesia. Alright, this transient global amnesia is usually lasting for less than 24 hours. But there can be full recovery, but there will be no memory that is formed during those 24 hours. So patient does not remember that. Alright, we do not know what the cause is, but most commonly on MRI, if you do an MRI imaging for these individuals, it is the lesion that is associated with the hippocampus. Please do remember this. Sometimes they may ask. The patient is not able to form new memories during that period when he has got transient global amnesia, but he's got preserved personality. He's able to tell you his name, age, date of birth and everything, but there is nothing that can cause this. Alright, it is benign and it is self-limiting. What do you have to do? It is the reassurance that you will have to do. for transient global amnesia. All right. Next, we talk about vertigo and dizziness in the next chapter. Thank you very much. I'll see you soon.